I'm back again for another endometriosis video, and this time I will be discussing the different types of endometriosis found in surgery and also the different types of colors of endometriosis that is found in surgeries. I know you were probably thinking that the color, the color of the endometriosis established the type of endometriosis that it is, but it doesn't. It's a little bit more complicated than that, so I'm going to break this down for you so you can get a little bit more understanding of it. So, as far as the types of endometriosis itself, endometriosis can be classified into three different types based on their localization, which is the placement of where it is in your body, and the pathology, which is when they go in and they do the surgery and they cut it out and do a biopsy. They cut out spots that they believe is endometriosis. They do a biopsy and determine if it is endometriosis, and that pathology is what they use to determine what kind of endometriosis that you have. So, the first kind of endometriosis is superficial perinatal endometriosis. And this is the most common endometriosis. It's found in 80% of women who have active cases of endometriosis. Now, this type of endometriosis attached to your perineum lining and your uterus, inside of your pelvis, that is outside of your uterus. And your endometrium lining starts to affect that perineum lining. And they usually just look in there and give you some medicine that's to treat the pain. It's not really that big of a deal. It's a really mild case of endometriosis. But then you get to the second type of endometriosis that there is, and that is ovarian endometrioma, which is OMA, also known as cystatic ovarian endometriosis. This type occurs when the endometrium tissue implants itself deep within the ovaries. The surgical incisions, after you have had the surgery, it will still implant itself into you. So basically that means the endometriosis is still growing even though you had a surgery. And the most common type of treatment for that is surgical excision. It's when they go in and they cut the actual endometriosis out instead of burning it out. And that also could include removing the cysts from the walls of the ovaries. Instead of draining the cyst, they remove the whole cyst. It also can include removing the ovaries. With removing the ovaries, you usually have the most improvement of those symptoms, and a lot of times the symptoms don't come back if you have that form of endometriosis. And the third form of endometriosis that you can have is deep infiltrating endometriosis, which is also called diendometriosis. This type of endometriosis is found in the bladder, the bowels, in the rectal vaginal septum, which is the line that is between your vagina and your anus. And this is similar to picture just taking a paintbrush and splatting the paint on the wall. That is equivalent to what deep infiltrating endometriosis is. It's scattered all through the body. It's spots here, it's spots there. It's the most hard and aggressive form to treat because it's so many spots that they have to go in to get. It's not all in one place. It's not localized or anything. And it can't be treated at all without surgery. But it still possibly can't even be treated with surgery. So it's just there. And I know this is the most aggressive form of endometriosis to have. I've had deep infiltrating endometriosis. I've had it since I was 28. I am now 32. I have been in menopause since I was 28 when they took out my last ovary. As if you go back and look at the video of my surgical history, you can see that probably can understand of the breakdown just from listening to my surgical history, and that should give you an understanding of how people have deep infiltrating endometriosis opposed to someone who just have superficial perineum endometriosis. Is an extreme difference in the two. But with that, now, not only can endo appear in different places in your body, it also can appear in different colors. So the different colors, well, the only way that they can see these colors that they are is during a laparoscopy surgery. And a laparoscopy surgery is when they take a camera where they do 3 cuts. They do two cuts on each side of your belly button and one in your belly button, and they stick the camera down your belly button, and the 2 other cuts is for the robotic arms to go in and navigate and do what they have to do. And when they put the scope in you, the scope, it doesn't change the color of anything. It just basically is a microscope, but it's a long tube so they can see everything in there. And endometriosis is basically a microscopic type thing, especially if it's deep infiltrated, because it's on the inside of your organs. So they have to get inside of your organs with their camera. And that is the only way they can tell what color your endometriosis is. So different colors can mean different things. So if the endometriosis is black, dark brown, or blue, these lesions are often described as superficial, and those are usually associated with the first form of endometriosis I was telling you about. It's also called, they usually call it these type of endometriosis lesions a powder burn or bang bang shot. Can't say that that word on YouTube. These are also known as classic lesions, are considered to be advanced endometriosis, advanced enough that you need surgery, but not extreme. Then you have the red endometriosis lesions. These lesions are highly active and considered to be the first step to perinatal endometriosis, and that's when it starts to get into your stomach lining. So that's when it goes from just being in your uterus to start to go into other organs, and that's when it's red. And then there's also white. These lesions are considered to be crescent-shaped, heated, or glandular endometriosis, which means it's a very late stage. Some say that white and mixed-colored lesions are most likely to be histo, which is hysterectomy, histologically confirmed, which means basically you have to have a hysterectomy, and that's where the white lesions would be at, under where your uterus and all that was at, and when all your other organs is at under your uterus. And they also can be confirmed as black lesions too, or they'll be on top of the black lesion, so it'll be like a black lesion at the bottom and the white lesion will be on top of it. So that's why it's called multicolored lesion. And then the last color that they found in surgery is clear. Now, clear lesions are the most stubborn and may not be visible during surgery. Which is, as you can imagine, the hardest form to treat, because if it's clear and they can't see it, that means they missed the endometriosis, and that might leave someone with endometriosis, and they always got to keep circling back, because it's clear. So 9 times out of 10, they're always going to miss something. And it also has the highest growth rate in endometriosis. So all the rest of them might grow over, 5-6 years. Clear endometriosis usually grows in 5-6 weeks to months, like literally that fast. You could have a surgery and need another surgery. And that's another thing that people don't understand about endometriosis. Just because you have one surgery doesn't mean you want to heal. Like, I literally, personally, have to have maintenance surgery, which means all my major organs that they can take out to help prevent or help stop and slow this down has all been taken out. The only thing they can do now is constantly go back in and cut off the endometriosis that grows. And whether that's every year or every 2 years to 5 years. At this point in time, I will have to have surgery for the rest of my life, just to cut down the endometriosis when it gets to the point that there's so much that I can't go on. And there's a lot of women like this. I'm just to be fortunate that it's in my colon and in my pelvis and not in my lungs and other places like other women. But just because you have one surgery doesn't mean that's the end of it. Like I've said, I've already had 8 surgeries. I just had my 8th 2 weeks ago. So, and I'm as tired now. I'm probably more tired and more sick and more fatigued now than I was before the surgery. But it's starting to slowly come back and counterbalance itself out. But some surgeries I have the surgery. I'm great. I'm excellent. I get a good 5-6 months out of it. Some surgeries I get up off the table and I'm crappy. And I'm not going to say this surgery is like the surgery that messed me up, because it's not the same thing. It's just that as you know, anytime you have a surgery, you can't get an infection, and my body got an infection. So it's just taking me longer to heal than it has before. But other than that, like I said, I have a double whammy. I have deep infiltrating endometriosis, which is hard to even find because it's deep into a lot of extra organs, a lot of your internal organs that they probably can't even get deep into without. Basically, it gets so deep into your organs that the only way possible to go in and see that endometriosis in those organs is to give you an autopsy. And you can't have an autopsy while you're alive. So that's where most women are at. It's so deep into their organs that a doctor can't put a camera in and see. They can't go in and see. But I'm quite sure if they had an autopsy, they would be able to find and tell you everywhere that endometriosis is at. And that's just the sad and unfortunate truth. This progression of this disease is like cancer, even though it's not cancer. I'm not trying to offend anybody who has cancer. I'm not trying to say that we're like people that have cancer. But that's the only way that you can describe the way that this disease progresses and keeps going. There's no other way or no other similarity to anything else that we have known to man than cancer. That's it. It's not cancer. It doesn't kill as many people as cancer. I want to say maybe 1 in 2,000. So it's not that, but the progression of the cells, the endometriosis cell itself, the way that it spreads, what it does. Because when I tell you, they say, when I tell you the picture of how it's wrapped around my kidney is crazy. My pictures of how I've had spots. I've had surgery where I literally have no spots at all, and then less than a year later, there's so many spots because I have clear endometriosis, and they think they got it all, but they don't. Let me rephrase that. I have clear and red endometriosis, so when they think they get it all, they don't always do. They get all the red spots. That's the deep spots, but the clear spots are usually left. And that's how it's probably spreading. I'm not a doctor. I'm not saying that's exactly what's happening. I'm just saying that that's the only thing I can picture that's happening with what I have going on. So it's like it's no other logical way you cannot have endometriosis and these spots at all. When we do this surgery a year and we go in and we cut out all this over here where we find it at, and then 1 year later on the whole other side of your body is there. But anyway, we're going to keep diving into these videos and finding out more, looking into studies. Like I said, eventually I want to get women who have endometriosis together on this channel and talk. Once I get big enough, we can get together. But please, like I said, comment some topics you want to hear about your endometriosis. And please like and share, subscribe, and you all have a good night. Thank you.